You've had bypass surgery and you're now on 5 medications, but your heart is still failing. What should you do next? Tell us about this 71-year-old lady with heart disease.
So she also had a history of high blood pressure, high cholesterol. She's already had bypass surgery for a blocked artery in the past, but she came to us with shortness of breath with her regular activities at home, leg swelling and fatigue. She felt like she lost her freedom in life because she couldn't do things that she wanted to do, and she was already on 5 heart medications, a medication for acid reflux and a muscle relaxer.
And she had had bypass surgery. So here's a patient who was on pretty extensive medical treatment, but still had a lot of symptoms of heart disease. Now, the way I analyze a patient like this, it's not only the heart disease, but the total body is out of balance. And so often in medicine, you may cherry pick a certain disorder or disease to treat. And so that's the way medications work. But a medication works for this type of disease, a medication works for that type of disease. But our approach is the first to try to put the body in balance. And that's the approach that we like to take with a patient like this. So what was our assessment and what did we find?
On the ultrasound of the heart, it showed her heart was very stiff. It was squeezing well, but it wasn't filling up with blood well. And we know that about 3 million people have this type of heart condition we call diastolic dysfunction or trouble filling up with blood. And it's the more common form of heart failure.
Yeah, we commonly see this in people who are either diabetics, pre-diabetics, individuals with high blood pressure, or a combination of diabetes and high blood pressure, or you can have inflammation, which can cause stiffening of the heart. Now, the way I like to think of it is if you have this model and you have a heart that is normal, squeezes more easily, but a heart that's stiff, very, very hard to squeeze. So normal, abnormal. So this is a stiff heart and it doesn't relax normally. We call that diastolic dysfunction. So what was our plan of care and what did we do for this patient?
So we met with the culinary team and prescribed her a specific nutrition plan. We also met with the trainer and developed workouts individualized for this patient as well. We did some high-dose ozone therapy, which oxygenates tissue and improves energy production in the cells. We also did targeted supplement therapy based on what this person needed, and a very important part was medication weaning, and we were able to wean and stop 4 medications.
Very interesting, because what I like about this therapeutic approach is that it works at the cellular level. The nutrition, the exercise, the ozone, all of these things work at the cellular level. As I said before, an individual like this is biochemically out of balance, and so it's important to work at the cellular level to get her biochemically in balance. So once we achieve biochemical and physiological balance, then the body works to heal itself, and then it allows us to wean the medication. And so this is a very excellent approach, and I anticipate she's going to do well. So how did she do?
So initially she had trouble doing activities around the house and would get out of breath, but now she walked 13,000 steps in a large mall without ever needing to take a break. Her leg edema was gone as well. On her heart ultrasound, her heart function was better. She lowered her cholesterol by 23%, and her inflammation went down by 52%. And all of this happened in only 2.5 weeks.
That's quite impressive. So as you can see, this integrative approach that we use that works at the cellular level, not only is it very effective and more effective than the traditional treatment, but it's effective very rapidly. Oftentimes individuals think that lifestyle interventions take a long time. You eat some broccoli now, in 10 years something good may happen. But no, the right type of lifestyle intervention with certain types of targeted supplements and the like can lead to rapid improvement that can improve an individual's overall well-being and the overall outlook on life. I hope you enjoyed this segment, and as usual, if you have any questions or comments, leave them in the comments section, and until next time, take care. Thanks for watching. If you got value out of this video, please like it, subscribe, and hit the notification button to see our next show.